Right now, there is a group of mental health advocates arguing that Maine is underutilizing a program that is meant to help people in a mental health crisis.
They argue it could have been used to intervene in the case of the Lewiston shooter, but it was not. News Center Maine's Caroline LaCour shares why they're now calling on the commission investigating the shootings to look into what's called a progressive treatment program.
In Augusta Friday, Mainers are shifting attention towards the state's progressive treatment program.
I never knew much about anything about serious brain disorders until my son had schizophrenia.
Members of the Maine chapter of the National Shattering Silence Coalition are sharing personal stories and arguing the PTP is underused. They say it can help people going through a mental health crisis from hurting themselves or others.
Maine needs to wake up big time.
A progressive treatment plan is part of Maine state law. It can set conditions for anyone who has been hospitalized for their mental health. If the person does not follow those conditions, they can be forced to get psychiatric care.
A part that in Robert Card's case may have changed the course of tragedy.
Now this group is calling on the Lewiston Commission to investigate why the PTP program was not used in the months leading up to the Lewiston shootings.
Before and after Lewiston involve people with no awareness of their illness, anosognosia, and that's the group we're trying to get more help for.
Former Maine legislator John Nutting argues there currently isn't enough training for stakeholders like law enforcement, crisis response teams, and more.
Comprehensive training is necessary, and it's fully within our grasp.
Members also shared a timeline of events on how they believe a PTP program could have helped before the shootings and recommendations to further address Maine's mental health needs.
Use the PTP statute as it's written, train law enforcement, and go after this federal money.
A spokesperson for the commission says members are now reviewing the submission. In Augusta, Caroline LaCour, News Center, Maine.
We reached out to the Department of Health and Human Services, and a DHHS spokesperson directed us to a statement the agency sent to News Center, Maine a few months ago. It says in part, quote, "The department is deeply committed to working with law enforcement and the broader medical and behavioral health community to support individuals with complex mental health needs and to protect the safety and well-being of Maine people." We also reached out to the Maine Criminal Justice Academy and Maine State Police to learn more about how officers are trained in PTP. We are still waiting for a response.